Wendy Steffes. Today we're going to be doing our cardiovascular and peripheral advanced assessment. This is my patient, Ashlyn. So we're going to go over a few things and I'm just going to run through it. She has agreed to go through with this assessment for me. So I know that we're being videotaped. All right, so my first thing that I'm going to be doing is I'm going to do a visual inspection of her jugular venous pulse. And in a healthy adult at her age, you should not be able to see that visually, especially as she's sitting up. So at this point, I don't see anything that would cause any kind of concern in regards to that. Ashlyn, I'm going to go ahead and have you lay down, all right? And then when I do the assessment, I will always be on her right side. There are times where I might have her lay over to the left, especially when I'm auscultating, if I can't hear her heartbeat there. So, all right, so first what I'm going to do is I'm going to auscultate her carotid artery, okay? And so I'm just going to listen for any bruit, which is a swishing sound or any vibration. So, okay, sounds good. And then now also, before I went over and I didn't look for, is also looking in her suprasternal notch to see if I see anything that I'm concerned with that, and I don't see anything there either. Okay, so now moving on, we're going to listen to heart sounds, and when we listen to heart sounds, you listen with the diaphragm as well as the bell. So I'll listen for the diaphragm first. I'm going to be listening to that lubden sound, which is the S1 and the S2. Okay? And I can hear it very clear in there. Sounds very. And then I go over 4 points just to make sure that I get all aspects of that heart. Okay. All right, Ashlyn, that sounds normal. Perfect. Okay, and now I'm going to switch it, and I will use the bell side. And when I'm listening to the S1 and the S2 and S2 are part of the cardiac cycle. The S1 is the systolic, and the S2 is the diastolic cycle, or the diastolic portion of that cycle. Okay, Ashlyn, that sounds great. Okay, next what I'm going to do is I'm going to palpate her carotid artery. So if you'll just kind of lay back a little bit, and I'm going to do that on both sides. Okay, so nice and strong. Wonderful, Ashley. That's perfect. Okay. Moving on, I'm going to have you lay on your left side and do the same thing there. I'm going to palpate your apical pulse, okay? Actually, lay back, Ash, so you can see. Sorry. At first, what I would do is I would go along her suprasternal notch and then find her intercostal space. And as I palpate, I'm trying to palpate her arteries down here. I'm not feeling it quite strong. Okay, and to the apex of the heart. Okay, and then why don't you lay to the side on your right side?
My right.
Or I'm sorry, your left side. Okay. And kind of scoot back towards me. I'm going to see if I can palpate the apex here and feel that for that. And yes, I can at that point. All right, Ashlyn, perfect. Go ahead and lay back on your back. Let's see. So now we're what I was palpating for is I'm also going to look for when I'm measuring for size, strength, and the duration of the pulsation. Okay. All right, now we're going to move on to your peripheral vascular system, okay? When I do that, I'm going to have you sit up, okay, Ash?
Okay.
And then just kind of move your feet over to the side. Perfect, okay? So I'm going to start from the top, and we're just going to look at her arms, and I'm just going to do a general inspection of her arm, basically. Just basically look at her skin tone. I'm also going to feel just the warmth of her skin, make sure that the temperature is good, that she doesn't have any, abnormalities at all or anything that I'm concerned about. Check on both sides, okay? Just kind of look at her hands, inspect those as well. Look at her veins there on her fingers, great. And then on your arms, I'm also, let's see, your fingertips, I'm gonna be looking for any kind of clubbing, okay, along her fingertips. Her fingers are beautiful. She has what I call piano fingers, so she should play the piano, but she doesn't, and that's okay. And then as I go down, I'm gonna look at her legs as well. I'm gonna look at her skin color and also inspect, also feel and kind of palpate around, make sure that she has, you know, in a male, we're gonna look for distribution of hair, but of course, females usually shave. She's a little stubbly, but right now, I'm feeling even distribution, and I don't see any abnormalities that I'm concerned about whatsoever, okay? Especially on her feet, I'm looking at that as well. Everything looks well there. Skin color's good, and skin temperature, a little cold, but for the most part, it's looking pretty good. We're gonna go on to, actually I wanna do a capillary refill, so I'm just gonna check on her fingertips, make sure that she has good capillary refill, so less than 3 seconds, and do that on both hands, okay? And everything looks good there, Ash. I forgot to do your thumb on that. And as well, do that on her feet. So each toe, just gonna make sure that her capillary refill is good, and they're looking beautiful. Nice clean feet, that's a plus. We like that as well. So, looks wonderful, Ashlyn. Okay, now we're gonna check for all of her pulses. So first I'm going to check for her radial pulse, okay? And we do that on both sides of her hands, and then her ulno. Okay, and I'll do that as well on this side. Perfect. Okay. Nice strong pulse there. We're going to do her brachial. That's perfect. And then on this side as well. Okay. Then we're going to go to the upper inside of the arm, which is, I might have a difficulty pronouncing that, the epitrochlear. I might have to scoot over on this side. Sorry for my videographer to do that. Okay. And then Ashley, I'm going to have you lay back. I'm going to feel for your femoral pulse, okay? So go ahead and lay back here. And your femoral pulse, I'm actually going to go into your groin little area. So, yeah, just kind of lay down there. So feel for her femoral pulse there, okay? Nice and strong as well. Okay, and then I'm going to go ahead and bend your leg, Ash. I'm going to check for behind her kneecap, or her knee, is her, popliteal. I always pronounce these things wrong. So relax your leg a little bit, and you feel on both sides. I can feel that nicely. Okay, and let's check this side as well. All right, just kind of relax your leg. There you go. Okay, beautiful. And then let's go on to your pedal pulses. Okay, so I'm just going to check her pedal pulses here. And then inside of the ankle, the posterior tibial pulse. Okay, and that's nice and strong. That feels nice and strong as well. If I had a concern for a patient in regards to a DVT or a deep vein thrombosis, at this time I would do the Homan sign, but I don't have any concern in regards to that. Ashlyn is a healthy 20-year-old, and she's not having any complaints of any kind of leg pain at this time. When I was doing her pulses, I was also looking and kind of inspecting her legs as well. And as I'm inspecting these, I'm looking for any kind of varicosities on her legs. I wouldn't expect that she would have them at this age, but some people genetically will have those. So I would look for that. I would look at her skin color, check her skin temperature as well, okay? Just to make sure that everything is intact and everything's looking good. She doesn't have any lesions. I don't see any abnormalities with her legs whatsoever. She hasn't had any surgeries or any injuries that I can see either visually. And do you have any kind of complaints or any problems right now that you're concerned about cardiovascularly or peripherally at all? Okay. No. You seem like a very healthy 20-year-old female. All right, Ashlyn, I'm going to have you sit up now. And so the last test we're going to do is called the Allen's test. And this is basically patency of the radial and ulnar arteries. So I'm going to have her just place each hand on the bed here, okay? And then I'm going to have you do palm up here, all right, Ashlyn? And as she does that, on each hand, I'm going to basically feel on the inside here of her pulses, okay? And I feel those. And then what I want you to do is tightly make a fist, okay? And so tight fist there, okay. And as she releases that, I'm going to occlude it. Her hand will be her palm will be pale, and then it will return to a normal color. And we'll do this on this side as well, okay? Okay, Ashlyn, go ahead and make a tight fist there, just like you did that, okay? And then go ahead and release it, and it is pale, and then it also returns to her normal skin color, okay? All right, so that looks great. The last thing I would do, actually, I think I'm done. So I have gone through all the assessment at this point, and everything seems satisfactory, and she's a healthy female, and I'm not concerned about you cardiovascularly. So thank you very much.